Thank you very much indeed, Paul, and thank you for allowing me to be part of this day and this celebration and this opportunity to to think and to ponder and to to act and to be encouraged. Yeah, so I'm a very old palliative care doctor who has spent far too little time thinking about these things. I wanted to give a little bit of a background where I kind of come from in relation to this, and then the particular challenges for hospice and palliative care when we think about these issues. And we're so grateful to have uh, people like Kate and the Centre for Sustainable Healthcare to encourage and inspire us. And then to a little bit about why these awards are so needed and so important for us in the hospice and palliative care movement, and a little bit of a personal kind of way forward from here. That's what I kind of like to do over these next 10 or 12 minutes or so. So, am I a good ancestor? I guess these issues have become a lot more important to me as a grandfather than what they were. And I freely confess to feeling a fraud about speaking in such company. Um, but I guess many of us do. And that feeling of being a fraud can also be one of the things that paralyzes us. So I'm going to resist that sense of being a fraud because I may be a fraud, but if I'm a little bit of an active fraud, that's better than being a fraud by itself. Why this fraudness? Why this? The world feels overwhelming. I don't know what it feels like for you, but thinking about my grandchildren, I have five now, or four and a half grandchildren, and thinking about the world that they are inheriting. Yeah, I feel very fortunate that the opportunity that I've had to grow up, but I don't think my grandchildren will be as as complimentary about myself or my generation and what we have done. As a palliative care doctor, I placate myself by always saying that uh, today always feels first in palliative care. Yeah, maybe you know that as well, or I've felt that. And yet, and yet, the question remains: Am I a good ancestor? The concept of awards is a strange one because it kind of feels in medicine that so often feels, oh, once you've ticked the box, you've got there. And this isn't really about that. This is about transforming our minds, our hearts, our lives, and an ongoing commitment and connection. And is that not an award in itself? And yet, to get us started, to get us on the journey, these awards and the effort that has gone in to providing us with a pattern and a place to start is so valuable. I'm very conscious of my internal paralyzers when it comes to these things. A lot about extractive economic basis and how just, yeah, all of that stuff can really depress you and creates guilt and then emotional weariness and then, yeah, and the busyness that we face and that we embrace with our phones and our emails and our lives. Yeah, and it just becomes too complex. And those are just the internal paralyzers, the external the wars, Donald Trump, economic inflation, leadership, lack of agency. Will is anything I'm going to do make a difference? Workforce gaps and pressures, hospices closing. Yes, yeah, you can identify these things too. It's a tension, therefore, my greener self, I can suppress it because the patient in front of me, in comparison with the future beyond, it's a balance that the immediate suffering always seems more urgent, while the climate change suffering feels distant. And this is based on a hidden and a very questionable assumption. the patient must come first. And we can reduce that to that binary priority. But I'm aware within myself, this binary priority uh, can also be a shield I use from discomforting, deeper reflection. It's a familiar pattern in palliative care. We see it, don't we, in advanced care planning. We know advanced care planning, it can be so important, really long-term importance. But yeah, so often those important conversations are delayed. Well, it's just not the right time. Can we put it off? Can we put it off? So we do, yeah, we can do this, can't we? So what should good care really include? Yes, short term, but also long term relief of suffering, compassion, and dignity. And that dignity extends, yeah, extends responsibility for present and for future patients. We can't ignore them. Two repeated concerns of patients that I've looked after. Uh, will my family be safe? And will my family be secure? And that need towards the end of life for connection with the past, and also for connection with the future, to be part and continue to be part of our world. And so to support that. So, why then are these awards so important? And I'm so very grateful for all the hard work that's gone in to making these awards and giving a way forward. They provide concrete uh, counteraction to the paralysis of hopelessness, which my internal and external paralyzers need. They answer a question that I've been asking for some time. What can I do practically now? This gives concrete things which are possible. They provide structure and they provide achievable steps of what we can do. So, concrete actions. I've had a little look at through some of the awards and what some of you have been doing, and that they make me think, oh, I could do this. I should take this, and I've already done so to take this to our team and to our. I, this, yeah, we could set up a set up a green group. We could review our prescribing. We could review how we contribute to unnecessary waste. We could work together as a team to support each other to be our best, greener selves. This is achievable. This is something a commitment we could begin together. Yeah. And in palliative care, so much of my life has been about affirming how important death is, how it's part of life, how a good death is a valuable thing. It's not something to be feared. It's something, yeah. But in doing that, I've often forgotten that by affirming death, I'm also affirming life. And if I'm going to affirm death, I need to be involved in the affirmation of life and protecting life for future generations. This is a different kind of hope, but it's a kind of hope which several of my patients just recently have been really connected with. A hope, a hope of meaning, a hope of connection, a hope of being part of life for future generations, doing something real, doing something together with colleagues. So the awards, a journey of connection. Uh, I think in terms of the bronze award that's where I need to start in our team in raising awareness in all aspects of hospice life. Not it's not an extra. It's not just the green lot. It's everything that we do. Can we think how we are working and living responsibly in connection with our staff and with our patients, affirming the context of meaning of what we stand for in terms of respect for life and respect for connection, which our patients value so much. What really matters, and we see that again and again, that our consumer, or I do, maybe I'm speaking for myself, but um, I see again and again patients finding that our consumerist culture values are totally exposed by the dying process. And if we see that, yeah, yeah. So bronze awareness and silver, one of our uh, um, oh, uh, family coming embedding change, moving from awareness to actual concrete change, beyond awareness to informed decision making. Yeah, thank you for these awards. And thank you too to all of those who are recipients of the awards. Um, I want to say thank you more than I want to say celebrate. I think celebration is really important, but what you have done for me is much more encouraging me to actually do something because you have done something and you have achieved something and you've shown that you've been able to achieve something. That is so powerful and so important for, yeah, yeah, a poor ancestor. Thank you. I want to finish. I want to finish with uh, a short poem. I find increasingly as I get older, poetry or doggerel can say so much more than other things in holding the tension together. So I hope you will indulge me with these few words. It's called Between the Bedside and Beyond. I sit by beds where time has thinned to breaths and whispers, and in that space, everything feels urgent. Seconds etched by meaning into the imperishable. Outside, ice melts and forests perish beyond the hospice car park. I read the headlines: Ukraine, Iran, Sudan, incessant warnings of what the human soul can do. And I think, not now, not while this man is saying goodbye, not while she holds her daughter's hand. So I act now. I manage now. I comfort. I do not ask what this costs beyond today. I've called this virtue. The patient has got to come first. And yet, how easily it lets me turn away from the slower dying of the world those patients are leaving. Today, a patient gently probed my fixation on her hemoglobin. Her main concern was beyond all scans or blood tests. What will be left in our world for the living of my grandson? In her dying, she is thinking forward, while I think only now, forgetting that care stretches further than the bedside. Her grandmother wisdom encourages that what may seem small, a different choice, a quieter prescription, an awareness of ancestor responsibility are ways of saying that both today and what comes after matter. Her deepest concerns persistently question: will I ever learn to hold both the hand in front of me and the hand of generations beyond, and see those hands as one? Thank you. Thank you.
Thank you, Max. That was lovely. Yeah, really wonderful as ever that you're able to capture and encapsulate people are feeling around a particular topic or theme in that way. So thank you very much for creating and sharing that. And I think your honesty around some of the external and internal factors around paralysis and kind of stopping us from moving forward and activity is really poignant actually, and something that hopefully, as you say, these awards can help unlock for people. So thank you very much. Thank you. So we're now going to hear from Rachel. So Rachel Stancliffe, who is CEO and I believe founder as well of the Centre for Sustainable Healthcare, which, if you don't know, very much hosts and supports this network, but also delivers a wide range of programs, education and networks as well for different specialties to really drive sustainable change in healthcare. So Rachel, thank you so much for being able to join us today, and over to you.
Thank you very much. And I feel like I don't want to present now because that was so lovely from you, Max. I just want to sit here and be quiet and let it sink in. But I've got a few slides which I'll whiz through and try not to distract us from that beautiful poetry. And I hope we're going to keep that somewhere. Are we allowed to keep it up somewhere on the network? Anyway, it's great. Thank you. I'm going to attempt to share. Hope this works. Is that okay? Can you see?
Yes, that's great. Thanks, Rachel.
Okay, perfect. Thank you very much for having me. And I'm also very excited about the awards. I'll just tell you a little bit about myself. I got to sustainability quite a young age in a way. Only, you realize looking back, don't you? When I had quite bad eczema as a child and nobody really knew what was wrong, and my parents didn't know what to do. So from as soon as I could read and stuff, basically, I was kind of looking for solutions, I think, and trying to understand what would make it better, as well as why me kind of thing when nobody else around me seemed to have the same things. So that was a bit about kind of understanding about chemicals and our interaction with the wider world, I suppose. I then worked at Friends of the Earth as I was a teenager volunteering. And in those days, it was hilarious. We used to have people driving across Portsmouth, where I lived, with a few newspapers in the back of a car. So we have come on quite a long way from there. It was recycling did not exist really in those days. I lived and worked in the Soviet Union for a bit, and during the collapse of the Soviet Union, saw how quickly societies can break down, and that was really quite scary. It wasn't around climate change then, it was around system change, but it really was frightening how, I mean, I was working in public health and health at the time, and just how the vulnerable suffered and died, and how quickly really simple things just stopped working, and how communities broke down. So I think that kind of gave me an understanding of how fragile we are as people and communities. I came back to the UK and worked in evidence-based medicine for a bit, and The Cochrane Library for me was a fantastic kind of effort, global effort to work together to really, it's not perfect by any means, but I don't know if you know it, but it's a sort of attempt to bring together what we know around care in different specialties, what works, what doesn't work, and to really work together as a global community to improve the state of the knowledge base that we work on. And then about 20 years ago, I had obviously I knew about climate change and I knew about acid rain from my school days, and I knew about various bits of environmental breakdown. But about 20 years ago, I sort of started wondering about it again and thinking what was happening and realizing that it was quite bad. And so I thought, oh, then, clever people must be doing things about this because it's really quite bad. And I looked around and there was not much going on and I was really scared. So in a way that fear, and I started having nightmares and things, and that fear kind of propelled me. I know fear can sometimes make you stick your head in the sand, but it made me think, well, it's not too late yet, and we need to do something. So what can I do? So that's a very long way of introducing the Centre for Sustainable Healthcare, which we started about 18, 19 years ago now, which is a charity supporting healthcare, health and social care to some extent to lead and model climate action. And we've been collaborating with individuals and organizations over that period to try and understand what we can do, how we can work together, and where we can have the most impact in this kind of urgent situation. That's probably a bit of a repeat. We have 4 principles, and forgive me because I'm probably preaching to the converted here, and you probably all know this really well. But I'll go through it very briefly in case other people are looking at the slides. So prevention is, what we'd all like to be doing more of: promoting health, preventing disease, looking upstream, working as much upstream as you can. We know that's hugely underfunded and difficult to get funded. But we have to keep pushing for it. And I think the power of people within the system to push for that is much stronger than people standing outside and waving and saying this is where we should be. So really, really needed from those already within the health system. Secondly, we've got patient self-care, or patient empowerment, really it is. It's not necessarily about patients just looking after themselves, but empowering them to take a greater role in managing their own health, making decisions about their care. And also making sure that everything that is done with the patient at the centre properly. Lean service delivery, we think about cutting out waste of all sorts of kinds, and making sure that we're adding value all the time with everything that we're doing. So that's how I understand lean service delivery. And then low carbon alternatives, which is what some people kind of think of when they think of sustainability. They think just mainly of the number 4, which is prioritizing treatments and technologies which have a lower environmental impact. So all of those are important, obviously. Max talked about community and connection, and the palliative care community is one of our networks, and we've got 31 of those, which are set up. It's just really a way of trying to help people to connect with one another and ask questions and share assets and so on. I won't go through all of this, I think, because I'll leave the slides for you because I'm sure you all know this, but just to say that we know that there are already health impacts in the UK from heat, flooding, air pollution, and also indirect health impacts from mental health, for example, disruptions to supply chain, and increasingly, I think, probably food and water insecurity. So this is just to say that we know that climate change is already affecting health, obviously, and we also know that those effects are disproportionately felt by vulnerable groups, including the elderly, children, and those who are ill. So when we think about what we do, we obviously have to think about doing it with those people in mind, and doing it together with them involved. So that's largely why we started working with sort of specialties and networks, because those we see as the communities of practice that kind of include everybody who's involved in that care. So it would be patients, carers, staff, and industry, in terms of who needs to make the changes. We know this already. The 20s now we're more than halfway through. It's a really important decade, and we've got 4 years left now till 2030, and that is a really critical period. So I know we are all under a lot of pressure in lots of different ways, but it is important to keep reminding ourselves that what we're doing is important, and talking to other people about this and how much it matters is important as well. Just wanted to say a little bit about leading change, because the awards are a way of recognizing leadership and a way of supporting you all to be leaders, which you are already, because you're doing this. And we know that climate change is a really important kind of leadership challenge. And it's not just a technical thing. I would say it's largely not a technical thing. There are obviously elements of it which are about, can we have different things, and can we do things differently? But actually a lot of it, and the will to do it, is about leadership. And you all, as palliative care professionals and teams, have different things going on, obviously, but I would guess quite a few shared problems and risks within that, but probably different capacities. So I was at a care home event today, where it was a greener care home workshop, and it was run by quite a wealthy care home, and we were talking about the importance of them having the resources, being able to kind of push forward with things, and then share those with those care homes that were less well resourced. So there's that responsibility and way of connecting, which is about sharing what our assets and sharing our problems and being honest with each other about solving them together. And we also know that we don't have to, Max, you referred to this kind of, dichotomy, maybe this kind of tension between, wanting to do the best now and wanting to do the best in the future, and then sometimes not being the same. And sometimes they're not, but so many opportunities for change bring patient benefit along with sustainability that we've seen over the years. And it is really encouraging. So that's a way of saying, I suppose, that the awards for me are really important, because they give case studies of those things, as well as modeling best practice, and as well as building capacity within the palliative care world. And the other thing maybe that people talk about quite a lot is what inspires people to change. And as I said at the beginning, my kind of inspiration in a way was fear. I don't think that's always helpful, and we've tried over the years to very much push the positive, and emphasize the positive, because I think a lot of people are just really put off by fear, understandably. And so depending on who we're talking to, I think it's really important to stress the opportunities that sustainability brings. This is not doesn't have to be a kind of burden. It doesn't have to be an extra thing. It can be something that really gives us an opportunity to kind of rethink how we do things in a very positive way. I would encourage you to tell your story. Max also touched on this, and he's obviously very hearts as well as minds, which is great to see. because I tend to use data too much, and they are important, but they're definitely not enough. And we need not to be afraid of telling stories and being vulnerable and being open about what's brought us all here, because they're things that will help other people to connect as well. So I suppose I'm just keen to support anybody who wants to do more all the time, and you are all here because you're already doing more. So as leaders, we can recognise that climate change is a core health issue. We can commit to doing our part, playing our part to transforming for more resilient and low carbon systems. We can share knowledge in our communities, and we can also make sure that we keep equity central, so prioritising the most vulnerable in our communities. That's just a summary of what I've said, I think. And a reminder that the Palliative Care Network is on our Networks Hub. I think we're going to put a link in the chat for people. The network's there to support, as I've said, the community to ask questions, grow, share resources, and so on. So you can upload things onto there, and it can be a place where you keep communicating with one another, but also point out, good papers or case studies or whatever you come across. And if you're not sure how to use it, then do get in touch and we can help you. We also run lots of different programs, and those include sustainability and quality improvement, the Green Team competition. We have sustainability sort of analysis, which is helping some of the other work that we do and underpinning it with some data. We have a Green Space for Health program, which includes the NHS forest, planting trees and we've got 10 now, nature rangers at different hospital sites in the UK. And we run courses. And there's quite a lot of courses now. There's not one in palliative care yet, I don't think, as far as I know. But there you go. That's something to think about for the future. That's it. Thank you very much.
Thank you, Rachel. Yeah, that was fantastic to hear a bit more about your own sustainability story. And I think always really useful to be reminded of the kind of environmental impacts on health that we're seeing here and now in the UK and how that manifests itself now, but also a reminder that, yeah, we are a community and we can come together and lean on and learn from each other. And I think that will hopefully give everyone confidence to do more, and a great array of courses. I've done a couple of the courses myself, and yeah, fantastic that the centre runs. So yeah, thank you very much for everything you do. I'm going to hand over to Kate now. Kate, one of our other co-leads of our network. Kate's going to talk a little bit more about the Greener Palliative Care Award and how it's been running, and introduce some of our fantastic sites and teams who've been part of our pilot too. So over to you, Kate.
Thank you, Paul, and thank you, Rachel and Max. I'm also sitting here feeling quite kind of inspired and reflective. Yeah, lots to think about. I'll just start before I put the slides up by, I guess, telling you a little bit the story of how we came up with the Greener Palliative Care Award. And I suppose maybe I'll start with my own personal why. So I've done a lot of kind of environmental action in my personal life, made a lot of changes, as I'm sure many of you on the call have done as well. And just slightly got to a point where it seemed odd that I'd made all these changes in my personal life, but my professional life, as Max alluded to, was this separate being where the patient comes first and there's no space for any of that. And kind of got to the point where that to use sustainability in a different context, that doesn't seem sustainable. I need to find a way to coalesce those worlds. So sort of looking for like-minded people within the field, and came across our co-leads and founded the Sustainability Network to see what we could do as a specialty. And sort of through those meetings and those connections, as both of our speakers have alluded to, sort of came to the approach that people wanted a structure, they wanted to act, they understood the importance, but how are we going to move forward? How are we going to find a path through that meaningful action? So we started looking around, what are the possible options? What are other specialties doing? What structures can we use that exist? But I suppose the challenge in our specialty was we're quite diverse. We sit across hospices, sure, which are independent buildings often, but hospices that sit within larger organisational structures. Then we've got hospital teams and we've got community teams. And how do we create something that's meaningful for all of those different setups of delivering palliative care? So that's the structure that we decided to kind of create. So now I will show you it. And of course, our award winners are only too familiar with it. Hang on. So this, and you saw this in Max's slides as well, this is the basic structure of the award scheme that just gives you the highlights in kind of one shot. So there's 7 domains, moving through organisation and leadership, looking at supply chain, the direct delivery of patient care, travel, transport, facilities and estates, engagement, and crucially enough, some discussion, the inclusion of food, because it does make up such a big element of any organisation's carbon footprint. So those are the domains that we work with. And the other thing that I want to mention, just picking up on what Rachel said, is as we set this up and we were thinking about, Rachel used the phrase leadership, credibility, and cooperation. So you can see leadership's right up there in that first domain. And we knew that creating a leadership structure that was embedded and creating business as usual around sustainability was going to be really key. So we had that in there. And then we knew, and it was really interesting meeting our sites, that when we met teams who wanted to take part in the award, we were often meeting either the clinical leaders or the facilities and estates leaders. So what we tried to do is create leadership that encompasses both and brings those 2 sides of an organisation together. And then on credibility, what I've not put in this slide, but you'll see in my very last slide at the end, is we went out to related organisations, so both those working in the space of climate and health and those working in the space of palliative care, to get their buy-in, to say, do you think we're on the right lines? And do you think that this is something that you might support us with? So, for example, we've got the Association for Palliative Medicine who are hosting the award, information on their web page. Of course, we've got the CSH, we've got Hospice UK, Marie Curie, Sue Ryder, and I'm sure I'm forgetting someone, the UK Health Alliance for Climate Change, all of whom were central in us kind of setting this up and saying, do you think we've pitched this right before we go out to the pilot and test it in the real world? And then the other thing we did with our structure is we set up a bronze, silver and gold, which is familiar from many award schemes. And the way we thought about that is we wanted bronze to be kind of the entry level, but where an organisation is really becoming aware and laying the groundwork for the sustainable action that will continue. So as Max alluded to, it's not we've won an award, tick, we've done that. It's by winning the award, you have embedded those changes already within your organisation. And what we've seen from our bronze sites is often they've exceeded what we've asked them to do at bronze. So they're already doing more than we've asked of them. And then at silver, the idea is that you're active. So you've moved beyond that. What is it we need to do? But you're starting to really begin to embed those changes. Then by the time you get to gold, you are achieving demonstrable improvements in your environmental impact as a palliative care team. So that's the way we structured it. You can see all of that on the APM's website, which hopefully Paul or Ollie will now pop into the chat, which gives you the background, some FAQs, and then links to all of the key information, and crucially, links to where we're at the moment, which I will come back to once we've heard from our winners. I will give you a quick whistle-stop tour through our 5 current award winners, and then we're going to hand over to them to hear from each of them as well. So we have joining us Marie Curie Hospice from Cardiff and the Vale, who are one of our bronze winners. And I love this picture where they've got a printout of the award, which I believe they've put in their entry to the hospice so everyone can see what they've managed to achieve. We've hopefully got Sue Ryder with us, but I will just say that Sue Ryder, who's currently at bronze, we're almost ahead of us as a sustainability network. They are the authors of the carbon footprint of a hospice paper, which some of you may have seen. And I've got gold on some of the domains within the award structure, and we will still be working with them. And they may be achieving further levels. So watch this space. We've got Forest Home Hospice with us, who are our first ever Silver Award winners, which is fantastic. And they've been wonderful to work with and really interestingly positioned within the NHS and a hospice. So that's been an interesting organisation to work with. We have my own team. You'll see me in the picture here, where the brief was to wear green for our Trust Sustainability Award, and one team member did not get the brief. But still a wonderful day. So that's Guy's and St Thomas's, who are a Bronze Award winner. And then we have the wonderful team from Southampton, who are also here with us, who've just been so enthusiastic and great to work with. So those are our current award winners. And I will stop sharing. And I'm hoping that we have someone from Marie Curie who is willing to tell us a little bit about their experiences.
Diolch, Kate. Prynhawn da. I'm Siwan Seaman. I'm the medical director at the Cardiff and Vale Marie Curie Hospice. And yeah, thank you to Kate and the other leaders for convening this celebration for everybody today. And yeah, we're delighted, as everybody else is, I'm sure, to have achieved the award. So I'll just spend a few minutes just talking through what's gone well for us, where we're at now, what we're thinking of next, and challenges that we faced along the way. So I think one of the things that's gone really well is this clear badge of progress, really. I think it's been a real morale boost for the hospice. We've had that award sign that we were holding up there. We've had it made into a window sticker, so we've got that on the entrance to the hospice with our sort of dementia friendly stickers and all the other achievements on display there. And we've also had quite a bit of press coverage, so we did make the front page of the Penarth Times as Wins Award. So yeah, so that's been great as well. I think having clinically led behaviour change has worked very well in our setting, and so some of the QIPs that have come directly out of this, our Gloves Off campaign, our syringe driver battery extension, has had lots of interest, and certainly after presenting at Hospice UK's session on the awards, we've had a couple of other hospices not involved in the awards approaching us and asking about those projects. So it's been great going back to Rachel's point, really, about connecting and sharing resources. It's been a great opportunity to do that via a sort of informal community of practice. The Gloves Off campaign was obviously not our campaign, it's the Royal College of Nursing videos and campaign, but doing it as a quality improvement project, demonstrating that we were reducing our use of gloves by over 700 gloves per week, was something demonstrable that we could really, and use the life cycle analysis, which we would have never done outside of the awards, to demonstrate, you know, the savings and the the return flight to New York and back over a year just through one hospice's use of reduced use of gloves. So that's great. It's been great for us from an organisational level alignment point of view. I didn't even know Marie Curie had a central office sustainability team, 2 people working in that team, and so they've really engaged with us and supported, especially the more procurement and facilities side of the standards that we needed to achieve. So that's been good and ongoing work with them, and they have just helped us in submitting one of the Screwfix grant award for Hospice UK as well. So that will be a relationship that we will continue with our central team, which is great. And great staff engagement, really. You know, our national team had done a travel survey the year before, and we've got 3,000 people, volunteers and staff working for Marie Curie, and I think they had something like 50 responses. And we did a travel survey of our hospice staff and had 70-something responses just from Cardiff and Vale. So we've had lots of engagement and great attendance at our green forums as well, which is great. So now I suppose it's from bronze to business as usual, and how we can continue to embed these things and build on them. And hopefully it's helped hardwire sustainability into our people processes. We've having it as part now of Marie Curie's national induction checklist and all job descriptions as well, which again wouldn't have happened if it hadn't been there as a standard that we needed to demonstrate. So hopefully those things will survive time and grow. And then, as we talked about, sharing and spreading, really, which is an ongoing. I literally had an email yesterday from somebody in Sheffield who'd spoken with somebody who was asking, have we got evidence on the percentage of the syringe driver 9-volt battery work, and asking information on that. So yeah, that's been great. I think what we've learned, starting with one visible behaviour, such as choosing the gloves off as the first domino, made the work really tangible and safe to try. And I think it created stories that people can then repeat on shift and grow in that sense. And making progress easy to see. So as I said, badges and stickers, I think, really help to embed that. But obviously, as with anything, there are challenges. Want to be honest about those. And I think, as we've already heard Max talking about, the competing clinical priorities is an ongoing challenge, and we'll always naturally prioritise that over work that's sometimes seen as sort of over and above and extra. So just trying to make that ongoing space to be able to prioritise these longer action and longer future-based improvements. And I think, evidence and measurement, and that's where the QIPs came in helpful, having individuals focused on that, having a clear measure and being able to demonstrate then translating those into real carbon emission savings and financial savings as well, actually. I think, yeah, that's probably it in a nutshell from me, because I know we've got lots of others to hear from. So diolch yn fawr, thank you, and very happy to share anything that we've done, and also shamelessly borrow from others this afternoon as well.
Brilliant, thank you so much, Siwan. It's really great to hear. Wonderful. And then we will have time for questions at the end, so if people have got questions, then please save them. Okay, I don't know if there's anyone from Ryder here. I may have missed them, so we'll just...
There is.
Yes, there you are.
Kate. Yeah, hi. Although I think possibly Rob Saunders was going to be on, and I know Paul Perkins is on holiday. So yes, I am on, but I haven't prepared anything, so it's going to be short and sweet. Apologies.
That's fine. Go for it. Just
right,
tell.
Brilliant. Thank you.
Like a brain dump.
Yeah, I will. Absolutely. Thank you. I'm Rachel. I'm the sustainability lead for Ryder. So I come from sustainability very centrally across our organisation. We're a large charity with 6 hospices, and one of our hospices, Leckhampton Court Hospice, was part of the pilot. And in all honesty, hats off to those that kind of led it from the hospice side of things. There was already so many great things in place when I actually started at the organisation 2.5 years ago. They are very much our driving force within the healthcare side of things at Ryder, and have massively built on what they've been doing over the past couple of years. So some of the things that we've done are things like gloves off campaigns, aprons off as well. We did that last year. Some amazing statistics that came from that, and great feedback from staff as well, from clinical staff. What it has done is it's really helped us kind of work out strategies and ways forward in terms of engaging other teams and other hospices across the organisation. So that is some of the work that we're kind of doing and planning at the moment. We've at Leckhampton, we've had the opportunity, we've got some funding for things like feasibility studies, for looking at solar panels, car parking with solar panels, carports, things like that. So again, it's what it's done is it's really helped us kind of focus in on some of those things that we want to really kind of start looking at: innovation, change, that kind of thing. So yeah, from an engagement point of view with staff within the hospice and staff right across the organisation, it's been brilliant. Our internal comms team have done a fantastic job of kind of just talking about the great work that's been going on at Leckhampton. Talked about, we did a lovely piece on what you guys do for the Palliative Care Awards. And that's really helped boost morale. We're about to run a second staff sustainability survey to kind of benchmark on a couple of years ago. And we're hoping that this might have helped kind of boost our kind of the uptake in terms of actually filling it out, but also in terms of those changes as well, those tangible changes. So that's one to watch in the next month. We've also got things like our quality and governance side of things. It's really helped us focus in on some of the requirements for CQC. It's definitely been a catalyst in terms of rolling some of these things out to other hospices, as a starting point, making sure that every single hospice has got a sustainability group, and kind of rolling that out from there, and having some key leaders that can take that and those initiatives forward. Some of the challenges have been around kind of, we've had some internal changes, so that's obviously becomes tricky to manage, and the usual kind of business as usual, all the usual day-to-day kind of pulls on our clinical team and our healthcare staff. But this has been a fantastic initiative to get involved in, and it is absolutely something we're talking about at our sustainability steering group at the moment, in terms of how we can potentially roll this out over the next few years across all of our hospices. And our hospice landscape, our hospice footprint is very varied, very different. They're all bespoke, and that's the thing that I'm trying to talk to each team about, in terms of what one can offer, the other will have lots of other things to offer. And just because they maybe don't have a growing garden like one, doesn't mean that they're any less able to do great things, show that impact, and show those sustainable changes. So that's been really key. Sorry, you might have just heard my my son then, so apologies. So all in all, we feel it's been a great privilege to be involved in the pilot. There's been a lot of interest across the organisation, and we're absolutely chuffed to bits with our Bruns Award. Like you said at the beginning, Kate, there are things that we're doing that really do hit lots of other areas, silver and gold, and we just want to keep the momentum up and keep going and keep improving. So thank you to everyone for your help and support.
Well, thank you.
That's
wonderful.
Me. Thank you.
You have plenty to say. That was lovely. It was perfect.
Once I start, I can't stop.
Yeah.
Thanks.
So true. Okay. Just of time, so we will move swiftly on. I believe I saw Saskia from Forest Home Hospice. Oh. Saskia, are you there? I can see you, but I can't hear you. Oh. Okay, yep, no problem. So, Steph from GSTT, sorry for the surprise, but you're up while Saskia tries to sort that out.
Can you hear me?
Yes,
Great, because
fantastic.
I've been having issues. Hello, everyone. I'm Steph Ainley. I'm one of the palliative care consultants here at Guy's and St Thomas's. So I thought I'd start again, like Kate, with what's my why. And I think pretty similar, trying to do a lot in my personal life, but feeling very powerless at work and just getting very frustrated day in, day out, but not really knowing what to do about it. So really nice that this award has so much structure. I really enjoyed that. So Guy's and St Thomas's, we're a big NHS trust, and actually the trust as a whole is really interested in sustainability. And then within our palliative care team, so we have inpatient teams at 2 hospitals, and we also got a community team that covers the local area, so a nice mix. And I felt that we got a lot of support from our palliative care senior management team to get involved, which made it just really, really nice and easy to start the process. Talking about some of the things we've learned and some of our successes, I'd probably say one of our most successful things, and again, it was probably a little bit beyond bronze, but we went from having paper handover lists for our inpatient teams to having it all on our hospital system. And we worked out it saved 30,000 sheets of paper a year. It saves at least £3,000 a year. But actually, when we surveyed all the teams afterwards, after making this change, actually the thing that the teams noticed the most was it was really time saving, and that was actually the most significant thing to them. And I'd never really understood what the triple bottom line meant before. Kate talked about it and I wouldn't really understand, and then actually it showed. We made this change and we hit all 3, and like other people have said, the teams were really enthusiastic and just really I think really grateful that this change had been made. So that was probably our biggest success of the year. We also did quite a lot of teaching sessions. We did a teaching session to the whole palliative care team, as well as some smaller, more focused ones, alongside sort of meat-free Mondays, green days, as you saw, when everyone dressed in green. I think in terms of my experience, there was lots of enthusiasm throughout the team, which was brilliant. I think there was also a lot of interest from the wider trust, which I was a bit surprised about, because sometimes in palliative care we feel a bit, we're a relatively small team, but actually, particularly when we got the award, we've had lots of interest and excitement from the trust. We've been on the trust intranet. So it was really nice, something that we could publicise and get recognised for. And challenges, I think, similar to everybody else, there's lots going on. I'd say for me, a challenge was, because we are such a big trust, trying not to reinvent the wheel and realizing there's so many other teams already doing lots of brilliant work, and just trying to find out who's doing what, joining meetings, working together so that we're not all working separately. So it was a challenge, but actually can be a real advantage as well. So I think, that's everything from me. We really enjoyed doing the award. Our hope is that we will progress on. And that's it. So thank you very much.
Brilliant, Steph. Thank you so much. Really interesting to hear, because obviously GSTT are one of the bigger trusts in the country as well. So just how it's worked within that learning curve. Okay, let's go to Southampton. Try again.
So my name is Polly Curtis. I'm the lead nurse with the supportive and palliative care team at University Hospital Southampton. So sustainability within palliative care is not something that I'd really explored previously, and that really drew me in when our trust clinical sustainability lead shared the link for this pilot. It felt like a really exciting opportunity to stretch us as a team and to think about something totally different to our everyday clinical work and our other kind of non-clinical work as well. And it felt like a project that we could contribute to really meaningful improvements in our practice. We knew it would align with our trust's goals, and slightly selfishly, I hoped it would kind of put UHS on the map as a champion for sustainability as well within palliative care. Something that really helped from the beginning is that we all chose to come together and do this. So there were 5 of us from our hospital palliative care team. There was no kind of scrabbling around for volunteers or persuading people that they wanted to take part. So we all started with that shared motivation, and that really helped to continue the work going forward. So what worked well, it opened up conversations that we hadn't had before, and it helped us to look at our everyday work through quite a different lens, and not just what we do but what impact that has. Like was just mentioned, the project actually unexpectedly boosted our kind of team spirit and morale, and we had quite a bit of fun with things. So we did a steps challenge for Earth Day and had a bit of sort of healthy competition amongst the team, people running up and down the stairs in the hospital trying to get the most steps. We had meat-free Monday lunch, which was fun and connected us. And it just reminded the team really that sustainability doesn't have to be heavy or complicated. There are small actions that actually add up. So talking about eating fewer meat-based meals, or just turning off our computers properly at the end of the day, they're really small asks, but they've had such a measurable impact with our team. In terms of challenges, initially when we saw all of the criteria, we were concerned that they aligned more naturally with hospice teams rather than the acute hospital. And we had to sort of try and translate some of those expectations into what that meant in an acute care context. So this took a bit of extra thought and creativity, but actually once we gave it some time and just kind of brainstormed it out together, and chewed Kate's ear quite a lot, and we realised that it was achievable, much more so than we realised, and actually we were often trying to achieve more than was being asked for us, and we needed to kind of reel ourselves back in and bring ourselves back to bronze. Like many teams, we're working in a system where our resources are really tight. We had good support from our clinical lead for sustainability, but obviously no financial backing or protected time to do this. So, you know, it was really about us being very passionate and organised about getting this done the best we could. So where are we going next after bronze? This, you know, is a great milestone for us, but we don't want it to be the end of our work. So we're due to meet in a couple of weeks to consider what our next project is, to try and keep the energy going. There's a couple of projects in mind. So we've got food waste as a focus. Within the bronze work, we looked at how food and nutrition and palliative care linked with some of our work during Dying Matters Week last year, looking at patients who were receiving bigger portions than they wanted, or not being offered the full range of menus, or culturally appropriate choices for food. So we've linked this work with some other work we're doing with the university around equality and diversity, around which patients are offered what food, and is this contributing to extra waste. We are also currently undertaking a 12-month proactive palliative liaison project where we're reviewing patients in admitting areas of the hospital. So we're looking at how we can reduce or stop inappropriate interventions, and there's clearly a financial saving and reduced length of stay, but we're also wanting to include the carbon cost of this, and we're aiming to publish this work. We're hoping to keep connected with other sites that have been doing this work, especially other acute hospitals. We have found it quite hard to keep up with the sustainability network and all of the emails that come through with notifications. So we wonder if there's a chance for some more peer meetings, just like this one. Really, hearing what other people are doing would be really meaningful for us. So overall, it's really strengthened our team's cohesion and raised a lot of awareness. And we're really grateful that we were chosen as a pilot site. So thank you.
Thank you, Polly. That was really lovely to hear. And I do remember when we were setting it up, one of the ways we were sort of trying to sell the pilot scheme to encourage people to take part was that, coming out of COVID particularly, this was a chance to do something positive as a team and to get that team bonding aspect of it as well. So it's nice to hear about that. Okay, Saskia, last chance. Can we hear you?
Any good? No?
Yes, we can hear you. Hooray!
Hey, I'm on my phone. I'm really sorry that will trouble. Anyway, I'm Saskia Dorman. It's really, really lovely to, and it's brilliant to be here. So inspiring so far. So just thank you. So I work at Forest Holme Hospice, which is, as Kate said, is part of University Hospitals Dorset. So University Hospitals Dorset, 10,000 people organisation. Forest Holme Hospice, about 70 people. Yeah, I've worked there for 20 years, kind of thing. And we'd started our initial kind of sustainability and greener living is kind of really important to me and has been for years and years. We started our kind of work or trying to kind of encourage people to talk about it at the hospice a few years back, really on quite an informal basis. And I think one of the things that I've really appreciated about this award and the structure of it is just helping to move from chatting about it with people when I feel brave enough to, because I think they're not going to think I'm crazy or mad or something, but just being able to build it into the kind of the structure that's shared, things like the governance side of things. We'd had a kind of informal green eco group with the kind of a few people who were really cared and felt passionate about it, but it didn't seem to really spread beyond that. Whereas with the Greener Palliative Care Award, just the structure of that meant that, okay, well, let's have an actual green group and let's actually meet every month, first Tuesday of the month, 11 o'clock, let's get together and meet face to face, and we'll have minutes. And it goes through to the quality and risk monthly meeting, the palliative care quality and risk group, which I'm not really a committee type person at all, but actually having that structure and having that kind of rhythm of monthly meetings and the kind of feed through to the governance that goes up through the UHD governance as well, just has really helped. And it's helped not only in terms of what we do and having the structure and trust-wide visibility of it, but also it really helped with the engagement. So from the engagement side of things, we had things like lunch and learn. We had, like, as my therapy, I kind of made these little booklets with little, cartoons about different ways in which greener palliative care can be. So a part of our lunch and then was like a DIY, make your own sandwiches, a bit of fruit, very cheap, very healthy, and greenish, which was cool. And that got people talking. We had these little booklets and people were just talking about the different issues. So there was a kind of informal staff engagement. But in the quality and risk meeting, a physio piped up who hadn't been to that lunch and learn type event, but said, "Oh yeah, because we've been kind of doing some with walking frames, and kind of rather than always getting in new walking frames, it's like kind of making sure that we can circulate them and obviously clean them and make sure they're safe, but to reuse them and not to always go out and buy new." So the formal governance really helped with staff engagement as well, and lots of ideas came through that space. So that was really helpful. Another thing I found kind of being part of a bigger organisation, part of the trust-wide acute trust thing was in terms of facilities and estates, kind of making friends with people from there was really helpful. Catering. In January, there was a really good webinar from one of the nutritionists, and that was a really nice way to kind of meet people from different parts of the acute trust organisation, and from that developed a kind of plant-based healthcare interest group, which kind of extends well beyond palliative care. Do you know what I mean? So I think that trust visibility and kind of extending and kind of it's just been great. And I don't think that would have, I don't think we'd have been so active in that without the Greener Palliative Care Award. So thank you for that as well. some of the other things that we've been working on. So again, sort of ideas coming from staff. There was one of the nurses on the ward who, was just said, when we do lots of subcut injections, for example, and she noticed that some of the staff would always use 2 syringes to give a subcut injection and always give a flush with a separate syringe. And it's like, but it's the same patient, and you can use the same syringe and it's fine. So and she was just brilliant at kind of really just helping her nursing colleagues in particular to feel just confident and comfortable to change their practice in that way and really reduce the amount of syringes. Gloves off campaign people have talked about as well, which has made a massive difference. So yeah, I'll probably kind of leave it for there for now. But I just thank you so much for enabling this kind of structure, because it has definitely helped us to move forward and kind of gain that confidence and keep going even when it feels tough, because it really is important. And just thank you. And I think also for this evening, it is so important to celebrate what we have done already. It's so easy just to think, but there's so much more to do, and there is so much more to do. But thank you for let's celebrate what has been achieved by everyone so far. It's fab. Thank you.
Nicely put, Saskia. Couldn't agree more. And I want to just extend a thank you to all of our pilot sites, because what we asked of you was to join us on a journey. We said, we've come up with this thing, we've checked it out, and we think it's going to work, but we don't know. So will you try it out with us? And you were, all of the sites here, and we're still working with a couple of sites as well, were brave enough to come along that journey with us. We didn't quite know where we were going to go. So thank you so much for that. It's hugely appreciated. And you've all been wonderful to work with. So what's next? So let me share with you where we're going next with as we come out of the pilot phase of the project. 1 second while I get the slides working. All right, so where we are going next is that we have launched the bronze criteria. So we've got the bronze, silver and gold, but just for now, the bronze criteria have been launched publicly. So they're available on the Greener Palliative Care Award site, which is, the link is there. And you can see just on the right-hand side of the screen there, that's the full criteria for bronze. So that's now publicly available. So any site, any palliative care organisation can start working towards that. And we are looking at the silver and gold in a bit more detail, because obviously we've had a few more sites achieving bronze. We need a little bit more time just to be sure that the silver and gold we're completely happy with. But yes, so that is now available for anyone who is interested. We've started producing just some examples. So I just shared one earlier in the week, actually, which was for all the domains, just to give you an idea of what kind of evidence we ask from you. And I often say to people, what I would love to be able to do is to come a bit like a CQC inspector and see your sites and meet you all. And you could show me your solar panels, and you could show Paul what you were doing within your green groups, and Angela could go and have a look in the garden, and it would just be wonderful. But we can't do that. So we ask for things like meeting minutes and evidence of your job adverts and what are you doing on induction, and can you share with us what teaching you've done. There is support available. So this is our Centre for Sustainable Healthcare network page, and you can see all of the resources. And I'm trying to code them all as Greener Palliative Care Award bronze, so you can see the examples from other sites. And I'm working through gradually the pilot sites who've achieved an award and uploading examples of what they've done, so you can see the sort of thing that we're looking for. I just put this in because in that spirit of cooperation, so one of the things that we discussed as our development group for the award scheme was, how do we think about the intellectual property that we've created while still being able to share what we've done. And so what we've done is used a Creative Commons licensing, which is something that you can do for free, that you can read about if you're interested. But essentially, it allows us to say, this is our work, but please share it, please use it, and please adapt it, with the caveat that it can't be used for commercial gain. So that's something that was really important to us, and yeah, means we are very happy for you to share that bronze criteria with anyone who's interested, with other specialties, with other fields, under those conditions. So what's next over the next few months? So We can tell you that for the bronze award scheme, we're expecting it to take an organisation around 12 to 18 months to work through the criteria and to produce the evidence that they've worked towards that criteria. That while you do that, there's support through examples, and we will absolutely be having more of these sharing practice, sharing learning events. I think the next one is probably going to be called something like terrifying technical terms, and we're going to go through some of the challenging concepts and sort of acronyms that people come up against and try and demystify and myth-bust some of those a bit. We can tell you that you will need to provide evidence that you've met the standards, but that we don't quite know how. We will ask you for that yet. More on that in a second. And that, so some of our remaining pilot sites may gain an award level in sort of the autumn of this year, but for anyone that's started working towards bronze, it'll probably be spring next year when we make our next awards. What we don't quite know yet is for organisations working towards bronze or an award outside of the remaining pilot sites, exactly how we'll want to see your evidence. It's a bit dependent on funding. But we will be providing updates via the Sustainability Network on that. And so it just remains for me to say thank you to everyone here. Thank you to our pilot sites. Thank you for your interest. And these are our supporting organisations. So thank you to all of them as well for their ongoing support and input, which has just been wonderful. So far, we've done all of this at the development, the co-lead assessment group, all unfunded and all run by volunteers. So just thank you to everyone who's been involved. It's been a huge ask, and I know you've given up perhaps more time than you were expecting to give up because it's gone well, which is great. So thank you to everyone. And we have a little bit of time left, just a few minutes for questions. So I might hand back to Paul just to see if there have been any. But yeah, thank you so much.
Yes, thank you. And yeah, fab to hear from all of you. And Saskia, I totally agree. We absolutely need to be celebrating what we've done here today. So hopefully there's others who've heard some tips, some thoughts, some ideas they can take away to their hospice who maybe are not part of the scheme, but absolutely those who are part of the pilot. Yeah, fantastic to bring everyone together and celebrate in this way. I think it's really important. So there are a couple of questions that just starting to come through the chat now. Rachel's asked about a cost of the scheme going forward. Would there be a cost to take part in the award or gain bronze, silver or gold award, or some kind of membership type fee? And Kate, I know that so within the Palliative Care Sustainability Network, we have a development group specifically for the Greener Palliative Care Award, which really looks at what we do next, how we grow it, how we expand it, how it develops. And we've talked about this at some length, haven't we, in terms of the pros and cons. I think, I don't know, from my perspective, it's challenging. We've created some intellectual property, obviously, that has value, but for me, it's not really that valuable if we keep it within ourselves and try and we want to get it out there and make sure as many organizations have sight of it as possible so they can make those changes, because obviously that's what this is all about. But then also there's the kind of thinking about the assessment and the work that needs to be done by the assessors. Again, we have a separate assessment group for the Palliative Care Sustainability Award that meets quarterly, that reviews all of the evidence or has reviewed the evidence of the pilot sites on a quarterly basis to make sure that those criteria are being met, and all of those people are contributing their own time, putting that towards doing that work. So it's really about scale, thinking about if we do have lots of sites, as we would love to, taking part and doing this award, it's managing that workload. So as Kate said, at the moment, the bronze award criteria is publicly available free of charge, and we are looking at options about how we then will be assessing sites who've started working towards that criteria over the next few months. And we are working with our friends at the Centre for Sustainable Healthcare to secure some funding for this award programme specifically. And hopefully, if we're successful there, we'll have a bit more capacity and resource to do more. But at the moment, we don't have any kind of firm plans around that. And certainly there's no fees attached to anything we've got out there so far. I don't know Kate or Angela or anyone else in the development group. I know we've got a couple of development group members here on the call as well. Kind of wanted to chip in on that.
There's nothing I want to add. No.
Yeah, I guess I was just thinking one of the things that we're hoping to have with the funding is to employ someone who will look at some of these things in a bit more detail for us. So might look at funding options in a bit more detail and kind of model some of the options. I think in general, our aim is that this stays free, but it's just about how we resource that. And one, just to give you a thought about one thing that we've knocked around but aren't certain on, is that maybe we have one level that's free and accessible for everyone, and then another level if your organisation felt like it needed a bit more support, that we then might offer a paid option that was you had a bit more contact, perhaps a bit more similar to what we've done in the pilot site. So that's the sort of thing we're thinking about. But
we'd also talked a little bit about kind of support that people that have already gone through the programme might be offered to offer people coming through and that kind of thing.
Yeah, and just building that community. But at heart, we all want it to be available and accessible, and that's the guiding principle, isn't it? So yeah.
Indeed. So just looking back at the chat, just lots of thanks. And yeah, thanks to the sites and for everyone who's been involved in developing the pilot. So yeah, really great, as I said, that we can come together and celebrate in this way. Does anyone else have any other questions they would like to ask either us as the network co-leads or obviously the other sites, or speakers that we had, Rachel and Max as well at the top of the call?
I'm going to ask Max something. Max, I would really like to be able to share your poem. So if you can when you send the slides, if you're happy for me to do that.
Sure. That's fine. You're very welcome.
That would be great. Thank you.
Well, yes, I guess just to wrap up then, a huge thank you to all of the sites, everyone who's spoken today, everyone's given up their time to be here today to celebrate and to hear about the pilot and what's happening next. Thank you to everyone who's been involved. I mentioned the development group, the assessment group, lots of people who've given up their free time to be part of this, and without that we wouldn't have been able to make any of it happen. I know a lot of the sites as well were doing this on the side of their desk. So yeah, thank you very much for your commitment to this area of work, and we're striving as a network to continue doing more to support the existing sites and as many as possible. And yes, hopefully we'll be bringing the Palliative Care Sustainability Network together, as Kate says, with more regular meetings that everyone can come together and hear from and hear about all the next steps. And yeah, lastly, just a big thank you to our partners. Kate mentioned them, but Ryder, Marie Curie, Hospice UK, the APM, and the UK Health Alliance for Climate Change, and of course the Centre for Sustainable Healthcare, because again, without that support and backing, we wouldn't be where we are today. So thank you very much.